Hi, Dr. Kevin Zorn, founder and director of BPH Canada. Quite often, my colleagues, patients ask, what's the standard follow-up? How do I follow patients after they've had BPH surgery? Quite simply, we want to follow up usually within about 4 to 6 weeks after our treatment to see the immediate impacts. We're going to do some questionnaire, specifically the IPSS, the International Prostate Symptom Score. It's validated in 32 languages. You can go online and look it up. 7 questions, we'll get that answered. So IPSS. Number 2, we want to get some functional objective data. Very easy test. You come in with a full bladder and you urinate against a special toilet, and that will measure the volume and the speed of urination. So let's take an example. A patient came in prior to a BPH surgery. He had an aquablation. Here you can see he urinated 139 milliliters. Took him about 68 seconds to empty, so over a minute to empty that small amount of urine. He had a lot of residual, so you can understand that this pattern here, this is what we want to see, the flow, the Q max. He pees and then he slows down, he pees a bit more. Sometimes there's some abdominal forcing to try and push some of that urine out. And this is an obstructive pattern, very flat curve. And the speed, the Q max, we can see is only 10. So we'd like to see over 15 or more to have a good flow. So here he comes back to see us, same patient, now voids 267 milliliters in 11 seconds. So we call that a bell-shaped curve, a rapid uptake, and now a Q max of 39. So all within a matter of weeks of having done, in this case was an aquablation, urinating like a 15-year-old boy. So those are, some objective data, followed up with a bladder scan to make sure that they're emptying well, and typically, once a year follow-up, depending on their age group, the PSA, so whether they'll follow up with their family physicians or come back to us to have that done, as well as an annual uroflow and a bladder scan again, just to make sure there's no signs of recurrence. We know that with any BPH surgery, like all surgery, there's always risks of recurrence, and that rate will be dependent on what technique was chosen, but usually under 10% by 10 years. And some of the other potential things that we'll look for, bladder stones, bladder nut contractures, prostate cancer, those are the other things we're screening for on an annual basis. So that's typically what my answer is for how do I follow up my patients, just making sure we have good continued care and making sure that they're aware of things to look for any signs of recurrence.